Good afternoon, everyone. In today's topic, I would like to discuss about what to know about goiter. So, when we say goiter, that is enlarged thyroid gland. So, when we say thyroid gland, that is part of our endocrine system. So, this is a male and a female endocrine system. So, when we say endocrine system, it composes the pineal gland, pituitary gland, and the hypothalamus, the thyroid and parathyroid glands, thymus, pancreas, adrenal glands, ovary, placenta, and the testicles for man. So when we say endocrine system, is a chemically messenger system comprising feedback loops of the hormones released by internal glands of an organism directly into the circulatory system. So, regulating distant target organs. In vertebrates, the hypothalamus is the neural control center for all endocrine systems. In humans, the major endocrine glands are the thyroid gland and the adrenal glands. So, the study of the endocrine system and its disorder is known as endocrinology. So, endocrinology is a branch of internal medicine. So, if a person has a background of endocrinology, we may call them, or if a person has the specialization with the said endocrinology, so he may called as endocrinologist. So, this is the thyroid gland. So, when we say thyroid gland, this is a gland that makes and stores hormones. So, pinamamahayan po ng hormone ang thyroid gland that help regulate the heart rate or so ang tibok siya po ang nagdidikta sa tibok ng puso natin. So, blood pressure and the body temperature and the rate at which food is converted to energy. So, tumutulong din siya na paano or gawing lakas natin yung pagkain natin. So, when we say thyroid hormones are essential for the function of every cell. So, kailangan sa lahat ng cell natin itong hormone ng thyroid gland para mapagana niya yung every cell natin. So, when we say thyroid and parathyroid hormones, so it is very important in our body. So, it is the thyroid releasing hormone that is come from the hypothalamus, then from hypothalamus to pituitary gland, so it is the thyroid stimulating hormone that influence the thyroid gland to secrete or maglabas siya ng T3 na tinatawag natin triiodothyronine hormone at saka T4 na tinatawag natin na thyroxine hormone. So, itong si parathyroid gland naman, mayroon naman siyang parathyroid hormone. So, itong si parathyroid gland is apat siya na maliliit na gland na nakadikit doon sa thyroid gland. So, ito namang si parathyroid gland, naglalabas din siya ng parathyroid hormone. Ito namang parathyroid hormone, nagre-regulate po siya sa level ng calcium in our blood, influencing the bone, kidney, and the intestines. So, when we say thyroid hormone, so yan. So, ito yung chine-check kung sa tingin ng doktor, may problema po tayo sa thyroid gland. Kasi, if hypothyroidism, bababa yung T3 at saka T4. So, if hyperthyroidism naman, tataas yung T3 at saka T4. So, ayan, yung TRH, TSH, T3, T4, at saka yung calcitonin, ito yung nag-involve sa parathyroid gland at saka thyroid gland na mga hormones. So, when we say thyroid gland, it is a very important gland. Kasi yun nga, may influence sa heart function natin, sa digestion natin, sa brain development and nervous system, sa bone health, sa muscle contraction. So, yan, when we say sa parathyroid hormone production, so kailangan din ang regulation ng thyroid gland. So, kaya na-involve dito yung bone health at sa kidney clearance rate. So, when we say thyroid hormones, it has a lot of function in our body. So, going to the every cell in our body. So, ito yung action of thyroid hormones in our every cell. So, from free hormone going to lipid-soluble hormone diffuses into the cell, then activated receptor hormone complex alters genes expression. So, to the DNA, to mRNA, ribosome, then newly formed mRNA direct synthesis of specific proteins in ribosome. So, new proteins alter cell activity. So, kaya very important po ang function ng hormone in every cell. Yan. So, it has influence. Pag may kulang, may problema. Then, pag may sobra, may problema din yung buong katawan natin. So, ito po yung hypothyroidism at saka hyperthyroidism. So, when we say hypothyroidism, kulang or inactivated po ang thyroid gland. So, magiging kulang po ang hormone. So, may mga problema po na mararamdaman yung pasyente. So, yun na yung lalabas na yung hair loss, tapos inability to think clearly. So, reduce heart rate naman yung sa hypothyroidism. So, madali silang mapagod. Tapos, madali silang manlamig. Tapos, yun nga, may memory problem sila. So, manghina talaga. So, opposite naman doon sa hyperthyroidism. So, although the same sila na may hair loss, tapos medyo magluwa yung mata sa hyperthyroidism, tapos mabilis ang tibok po dito sa hyperthyroidism. Then, at the same time, palaging mainit din ang pakiramdam ng hyperthyroidism. So, yan, hindi masyadong makatulog kasi yun nga, may mga anxiety din ito sila. Then, yun nga, magka-diarrhea. Opposite naman sa hypothyroidism kasi sa hypothyroidism naman, hindi constipated. They're constipated na hindi sila masyadong nagabawas. Then, ito yung hyperthyroidism. So, when we say hyperthyroidism, this occurs when your thyroid doesn't make enough hormone. So, kulang. So, that slows your metabolism. So, hindi masyadong gagana or hindi ka mabilis na matunaw yung mga kinakain natin kasi yun nga, sluggish. So, tinatawag nating sluggish kasi yun nga, that is influence kasi konti lang yung hormone. So, it can make you gain weight. So, tataba. Yan. So, sometimes they caused by a condition called Hashimoto's disease. So, ito namang Hashimoto's disease, that is an autoimmune disease. So, na parang pinapatay yung, pinahihina yung thyroid gland natin. So, kaya tinatawag na Hashimoto's disease in hypothyroidism. So, ito yung mga simptoma ng hypothyroidism. So, yun, tataba, tapos palaging pagod. Palaging pagod yung katawan natin. Tapos yan, muscle or soreness and pain. So, feeling or having a painful muscle. Yan. So, menstrual infertility problem. So, dry and flaky skin. So, yan naman yung problem sa hypothyroidism or or inactive thyroid. So, poor concentration and memory. High cholesterol level. So, yan yung problema sa hypothyroidism. So, when we say hyperthyroidism naman, if you're feeling irritable, so madali ito silang magalit. Losing weight, so nangangayayat. So, your heart races. So, yan, ang tibok ng puso ay grabe. So, kaya ang major complication talaga ng hyperthyroidism is cardiac arrest. So, and you're feeling weak. So, kaya manghihina. Kasi yun nga, ang bilis ng tibok ng puso is very fast talaga. So, we call them as tachycardia. So, your thyroid might be producing too much hormone. So, sobra-sobra naman po yung hormone ng hyperthyroidism. So, this is often the result of another immune system problem. So, known as Graves' disease. So, tinatawag din itong Graves' disease kasi yun nga, parang na-involve naman dito yung immune system but can be caused by other condition. So, may posibilidad din na iba yung dahilan bakit nagka-type hyperthyroidism. So, ito yung mga pakiramdam ng hyperthyroidism. So, always mainit talaga yung katawan, tapos yan, mabilis ang tibok ng puso, tapos may localized, so minsan namamanas din yung mga ibang parte ng katawan. So, yan, so nanginginig din yung katawan. Yan. So, finger clubbing. So, yan. So, opposite ito with hypothyroidism. So, yan, unintentional weight loss. So, hindi ka naman nagdidieta, pero nangangayayat sila. So, rapid heartbeat. So, ang bilis talaga ng tibok ng puso. Yan. Increased sweating. So, palaging pinapawisan. Increased appetite. So, malaki talaga ang kain ito. So, always silang nagugutom o madali silang magutom. Yan. So, heat sensitive. So, madali lang ito silang mainitan. Then, skin thinning. So, numinipis po yung skin nila. Then, fine brittle hair. So, madaling maputol yung mga buhok. Then, yan. Pero pareha din sila ng hypothyroidism. Pwede din silang magkaparehong may enlargement of the thyroid gland. So, yan. Ito, commonly may mga palaging ginadiarrhea po itong may hyperthyroidism. Then, nervousness and anxiety. So, always ito silang mag-complain na hindi makatulog. Then, palaging parang may tinatakutan na hindi naman nila alam. So, ito yung treatment ng hypothyroidism. So, since kulang po siya ng thyroid hormone, so, since the thyroid hormone is needed by every cell in our body, so, pinupunan po ng synthetic na thyroid hormone. So, standard treatment for hypothyroidism involves daily use of the synthetic thyroid hormone levothyroxine. So, yan. So, either Levothi or Synthroid and others. So, the oral medication restores adequate hormone levels, reversing the signs and symptoms of hypothyroidism. So, ang purpose po ng medication na to para ibigay o ibalik yung hormone na nawala, na hindi na nagabigay si thyroid gland, pero yun nga, may mga side effects din ito. So, kasi yun nga, synthetic siya. So, you start to feel better soon after you start treatment. The medication gradually lowers cholesterol levels elevated by the disease and may reverse any weight gain. So, pwede kang magbalik sa normal, pero treatment with levothyroxine will likely be lifelong. So, buong buhay, pwede buong buhay mo na ito na iinumin, but because the dosage you need may change. Your doctor is likely to check your TSH level every year. So, what is levothyroxine? So, levothyroxine is a thyroid medicine that replaces a hormone normally produced by your thyroid gland to regulate body's energy and metabolism. So, levothyroxine is used to treat hypothyroidism, low thyroid hormone. So, the medicine is given when your thyroid does not produce enough of this hormone on its own. So, yan yung purpose ng levothyroxine. So, when you say levothyroxine is also used to treat or prevent goiter. So, yan. Pag mag-enlarge na yung thyroid gland mo, pwede kang bigyan ng levothyroxine, which can be caused by hormone imbalance, radiation treatment, surgery, or cancer. So, maraming dahilan po na mag-enlarge po yung thyroid gland. So, may isa namang natural siya pero from pig po. So, tinatawag na armor thyroid or from pork. Yan. So, thyroid hormone is used to treat underactive thyroid or hypothyroidism. It is a natural product made from animal thyroid gland. So, that is from pig's thyroid gland. So, it replaces or provides more thyroid hormone. So, yun din yung purpose niya na ibigay sa'yo kasi yun nga, kulang ng thyroid hormone ang nilalabas ng thyroid gland. So, when we say hyperthyroidism treatment, so iba naman po. Kasi yun nga, ito sobra-sobra. Sobra-sobrang thyroid hormone na inilalabas ng thyroid gland. So, may mga treatment din po ito. So, ang tinatawag with the several treatments are, so, for hyperthyroidism exists. So, the best approach for you depends on your age, physical condition, the underlying causes of hyperthyroidism, personal preferences, and severity of your disorder. So, possible treatments include. So, kasi paiba-iba po ang naramdaman ng pasyente na may hyperthyroidism. So, kaya maraming regulation talaga o maraming medication talaga na ina-apply. So, of which, ayun na, may kanya-kanya ding mga side effects. So, depende na ngayon kung saan ka medyo parang medyo kampante yung katawan mo pag binibigyan ka nito. So, ito tinatawag natin na radioactive iodine. So, taken by mouth, radioactive iodine is absorbed by your thyroid gland where it causes the gland to shrink. So, parang ninipis yung thyroid gland mo. Kasi yun nga, ang main purpose nito is parang pahinain. Yan, pahinain yung thyroid gland mo. So, symptoms usually subside within several months. So, excess radioactive iodine disappears from body in weeks to months. So, matagal din siyang mawala sa katawan pag maghinto ka na nito. Yan. So, this treatment may cause thyroid activity to slow enough to be considered under. So, ang magiging side effect naman ito, magiging, if hyperthyroidism ka, pwedeng magiging hypothyroidism. So, kung ano yung symptoms ng hypothyroidism, pag umiinom ka ng gamot ng hyperthyroidism, ang lalabas, pwede kang magiging hypothyroidism. And you may eventually need to take medication every day to replace thyroxine. So, pwedeng maisabay yung pahina at saka yung pa-shrink, paliit ng thyroid gland mo, at the same time, bigyan ka rin ng thyroxine or the levothyroxine para maibalik yung hormone na nilalabas ng thyroid gland mo. So, yan. So, anti-thyroid medication. So, this medication gradually reduce symptoms of hyperthyroidism by preventing your thyroid gland from producing excess amounts of hormone. They may include methimazole. So, ito known talaga itong si tapazole and the PTU or the propyl thiouracil. So, itong propyl thiouracil, ito po yung pinapahina yung labas ng thyroid hormone mo. So, symptoms usually begin to improve within several weeks to months. But treatment with anti-thyroid medication typically continues at least a year and often longer. So, ang problema ngayon, ito po ay synthetic. So, mayroon po siyang mga side effects. So, for some people, this clears up the problem permanently. But other people may experience a relapse. So, pwedeng magbalik. So, yung iba, hindi na magbalik pag ginagamitan nito. Pero commonly, magbalik talaga. Kasi yun nga, ang main ano talaga dito is kung ano talaga yung nagiging cause or na ano talaga yung nagiging problema ng thyroid, bakit hindi siya ngayon nagalabas ng thyroid hormone. So, both drugs can cause serious liver damage. So, pwede silang makasira sa atay. Itong si tapazole at saka itong si propyl thiouracil. So, because propyl thiouracil has caused for more cases, so both drugs can cause serious liver damage, sometimes leading to death. Because propyl thiouracil has caused for more cases of liver damage, it generally should be used only when you can't tolerate methimazole. So, may mga side effects po talaga sila kasi yun nga, synthetic. Yan. So, a small number of people who are allergic to these drugs may develop skin rashes. So, ito mga side effects na to. Hives, fever, or joint pain. So, yan, pananakit ng mga kasukasuhan. Kasi yun nga, side effects niya. They also can make you more susceptible to infection. So you are more prone for infection. So, beta blockers. Ito yung ginabigay, alalay, kasi yun nga, ang problema with hyperthyroidism, pwede silang mag-cardiac arrest. So, beta blockers. So, ito ngayon, yung mag-control ng heartbeat. So, although these drugs are usually used to treat high blood pressure and don't affect thyroid levels, they can ease symptoms of hyperthyroidism such as tremors, rapid heart rate, and palpitation. So, kinokontrol nila yung mabilis na tibok ng puso. So, for the reason, your doctor may prescribe them to help you feel better until your thyroid levels are closer to normal. So, pero nandun pa rin yung cause. Kasi yung cause talaga is yung mataas yung thyroid hormone, kaya bumibilis po yung tibok. Ito naman, ito sa heart lang siya nag-control. So, sa heart lang siya po. So, these medications generally are not recommended for people who have asthma. So, bawal din ito. Kasi yun nga, synthetic din siya. And side effects may include fatigue and sexual dysfunction. So, pwede din po manghina ang katawan ninyo pag umiinom po tayo ng beta blocker. So, surgery. Ito na ngayon. So, pag hindi talaga ma-solve, so, continue pa rin yung problema, yung hindi ma-regulate talaga si thyroid gland, so yan, ito na yung solusyon ng common medical approach po ito na sinasabi po sa pasyente natin, pag continually or continuous pa rin po yung problema, so surgery or thyroidectomy. This is a removal of the thyroid gland. So if you're pregnant or you otherwise can tolerate anti-thyroid drugs and don't want to or can't have radioactive iodine therapy, so you may be a candidate for thyroid surgery. Although this is an option in only a few cases. So, yan. So, tatanggalin na lang kung hindi talaga ma-solve with synthetic medication at saka yung sa mga artificial na approach. So, in a thyroidectomy, your doctor removes most of your thyroid gland. So, tinatanggal po lahat. Risk of the surgery include damage to your vocal cords and parathyroid gland. So, more likely, so kaya yung ipinapaalam po namin sa hospital, pinapaalam po namin bago po magpa-opera na more likely, pwede ding magiging complication na mawala yung boses ng pasyente. Kasi yun nga, the nerve can be damaged during the operation. So, kaya yun, magiging complication din yun ng removal or ng operation or the thyroidectomy. So, for tiny glands situated in the back of your thyroid gland that help control the level of calcium in your blood. So, that is your parathyroid gland. So, very important po si parathyroid gland na nandyan po sa thyroid gland din kasi yun nga, siya naga-control ng level ng calcium in our blood. So, in addition, you'll need a lifelong treatment. So, pag na-remove na yung thyroid gland na yan, so, kailangan mo talaga ng thyroid hormone ngayon kasi wala namang thyroid gland na nag-secrete ng thyroid hormone. So, lifelong na po magti-take ng medication na levothyroxine to supply your body with normal amounts of thyroid hormone. So, if your parathyroid gland also are removed, you'll need medication to keep your blood calcium level. So, mayroon pong iinumin pag na-remove na po yung si thyroid gland, pati si parathyroid gland. So, yun na. Lifelong na po na may medication with thyroid hormone at the same time with medication to maintain blood calcium level. So, yun na. Palagi na pong umiinom. Kasi yun nga, wala na si thyroid gland, wala na rin si parathyroid gland. Para ang replacement doon is yun na, yung synthetic na thyroid hormone at saka pwede din yung sa pig na thyroid hormone at saka yung medication na mag-maintain ng level ng calcium ng blood. So, itong Graves' ophthalmopathy, ito yung nangluluwa ang mga mata. So, common ito na makikita sa may mga thyroid storm or mga tinatawag natin na toxic goiter. So, if Graves' disease affects your eye, so yan, nangluluwa ang mata, you can manage mild signs and symptoms by using artificial tears. So, dito na pwedeng magamit natin yung Renew eye drops natin. Yan. So, para at least ma-prevent natin yung eye. If your symptoms are more severe, your doctor may recommend treatment with corticosteroids, so such as prednisone to reduce swelling behind your eyeballs. So, for me, very advantage po na nagagamitin natin dito yung Renew eye drops natin. So, two drugs. Yan. Ito si rituximab or si rituxan and the teprotumumab are being used to treat Graves' ophthalmopathy. So, even though there isn't a lot of definitive evidence yet to prove that they're effective, so kahit hindi ito nakita talaga na effective, so si teprotumumab received fast-track approval of Food and Drug Administration. So, kahit na hindi masyadong nakita yung advantage nila, na-approve po ito ng FDA. So, more study about drugs as treatment for Graves' ophthalmopathy is needed. So, understudy pa rin po itong mga medication na to. So, in some cases, surgical procedure may be an option. So, pwedeng operahan yung nangluluwa ang mata. Paano? So, orbital decompression surgery. So, may tatanggalin po na buto doon sa loob ng mata natin. So, in this surgery, your doctor removes the bone between your eye, socket, and your sinuses. But, may complication din ito. Pwedeng maduling po yung pasyente. So, when the procedure is successful, it improves vision and provides room for your eyes to return to their normal position. But, there is a risk of complication including, yan, maduling po ang mata after surgery. So, ito po yung complication after surgery. So, eye muscle surgery. So, pwede ding muscle. So, instead of bone, pwede din yung muscle yung tatanggalin. So, sometimes scar tissue from Graves' ophthalmopathy can cause one or more eye muscle to be too short. So, yan. So, this pulls your eyes out of alignment, so leading to double vision. So pwede din maduling yung pasyente. So eye muscle surgery may help correct double vision but cutting the affected muscle from the eyeball and reattaching it further back. So may mga complication talaga kasi yun nga, ito is just a symptomatic solution for the Graves ophthalmopathy. So, Graves' disease. So, if you have Graves' ophthalmopathy or dermopathy, the following suggestion may help your eye or skin. So, don't smoke. So, bawal talaga yung maninigarilyo pag nangluluwa na yung mata kasi yun nga, smoking has been linked to the development of Graves' ophthalmopathy and can make the condition worse after treatment. So, mas lalong lalala po pag naninigarilyo po yung pasyente. So, keep your eyes lubricated. So, yun na, sinasabi natin na yung Renew Eye Drops natin, malaking tulong po sa lumuluwa po ang mata with regards to, hyperthyroidism. So, eye drops may help relieve dryness and scratchiness at any time of the day. So, if your eyes don't completely close, you can tape your eyelids shut or use a lubricating gel. So, at bedtime to keep the cornea from drying out. So, keep putting our eye drops or our Renew eye drops in your eye if you have these symptoms. So, a cold compress can also provide relieving moisture. So, protect your eyes. Wear sunglasses to help protect your eyes from the sun and wind. So, keep your head up. So, as much as possible, yung sitting position while matulog. So, medyo itaas talaga, elevated talaga yung head. Kasi yun nga, parang hindi masyadong mag-increase yung ng size ng mata po. So, yan. So, raising the head of your bed may reduce swelling. So, yan. Pwede siyang hindi masyadong luluwa if pag palagi tayong in a sitting position kasi kung maghiga mas lalo po mag-increase po yung blood supply doon at the same time yung water level na body. So how to treat the goiter naturally? So may mga natural approach po tayo of which for me and my patient have testified and have their testimony. So because they have witnessed how they be relieved with these symptoms of goiter or the hyperthyroidism and the hypothyroidism. So, yan. So, when we say negative factors, ito po yung nagpapahina sa thyroid gland natin or nakakasira sa thyroid gland natin. So, factors that reduce the production of thyroid hormone. So, ito, stress, trauma, so, ear infection, so, radiation, certain medications, autoimmune diseases, so, fluoride interferes with iodine. So, ito sila nagpapahina at sumisira po ng thyroid gland natin. So, may mga advantages po na pwede nating gawin na pwedeng makatulong sa thyroid gland natin. So, ito na yung minerals like iron, iodine, zinc, and the selenium, copper, and the magnesium, of which this is the content of our CTMD. Ito po ang nakakatulong mismo dyan sa thyroid gland natin to produce hormone. So, kaya kinakailangan po ng thyroid gland all of our glands in our body. So, study shows. So, I have been researched with that fact na, yun nga, many endocrinologists testify that our endocrine system needs minerals po talaga. So, also the vitamins and the amino acids. So, ito yung mga vitamins, the vitamin A, D, C, E, those are the vitamin B complex, and then the amino acids that is the thyroxine. So, kinakailangan po ng sustansya ng thyroid gland to produce hormone. So, factors that increase conversion of T4 to inactive T3 or triiodothyronine. So, ito yung mga reason naman na magiging inactive yung triiodothyronine natin. So, ito stress, infection, low-calorie diet, so inflammation. So, kaya binabawalan po talaga natin ang mga pasyente na may thyroid problem with regards to food that is not nutritious, food that is processed, food that is very high in uric acid na pwedeng makasira with our thyroid gland. So, there are a lot of factors also that increase conversion of T4 to T3. So, that is the selenium, zinc, proper gut and liver function. So, kailangan talaga yung mga nutritious food to function the other parts of our body para matulungan din itong si thyroid gland. So, yan. So, factors that improve cellular sensitivity to thyroid hormone. So, doon naman sa cell natin, kailangan din ng nutrients like vitamin A, zinc, and the exercise for it to become sensitive with the thyroid hormone. So, yan yung advantage ng ginagawa natin na holistic approach. Kasi yun na tinutulungan natin yung buong katawan, not necessarily on a specific organ or a specific gland only. So, buong katawan po ang tutulungan natin para magiging or magtulungan din sila to have their coordination in functioning. So, ito na. So, factors that affect thyroid function. So, yun na. Factors that contribute to proper production of thyroid hormone. So, yun na. Iron, iodine, thyroid. So, yun ang nutrients talaga. So, mga nutrients talaga ang kinakailangan ni thyroid gland to function properly. Then, there are a lot of factors that damage or conversion of inactive hormone in the thyroid gland pag hindi po naibigay yung sustansya. So, all in all, so makikita po natin sustansya po ang kailangan ni thyroid gland to produce the needed hormone for our cell to function properly also. So, kaya yun na, ang ano ko talaga, ang gina-advise ko talaga sa pasyente ko is focus on nutritional approach with regards to thyroid problem. So, the phytonutrient-rich fruit contains twice the amount of potassium as bananas and also contains monounsaturated fats which help regulate blood sugar and provide the thyroid with a steady supply of energy to function. So, kailangan talaga yung fruits at saka vegetables to supply the needs of our thyroid gland. So, yan. So, our essential greens. So, when we say fruits, very nutritious po ang ating or our essential C has a lot of nutrients that is can be produced by a fruit. So, almost all the same. Kasi yun nga ang laman ng essential C natin is mayroon siyang mangosteen at saka kamo-kamo. So, there are a lot of contain our essential C that a fruit can be advantage in the thyroid concern. So the same with our essential greens also, it has a leafy greens. So leafy greens are not only neuroprotective, but they also help down regulate inflammation in the body. So since inflamed si thyroid gland, kasi yun nga namamaga siya, so greens contain powerful antioxidants and carotenoids that help lower free radical damage. So, if in case na damage na yung si thyroid gland with a lot of damaging factors, itong green leafy vegetables po is makakatulong po siya. So, with the content of our essential greens, malaking tulong po sa ating thyroid gland po ang ating essential greens. So, yan. So, many people are concerned about natural occurring goitrogens, so found in dark leafy greens and cruciferous vegetables. However, no human study has ever shown that consuming cruciferous vegetables can induce hypothyroidism. So, goitrogens food, sinasabi kasi yun nga, maraming bawal din yung may mga problema sa thyroid gland. So, binabawalan po sila ng root crop, yung mga repolyo, bawal po sa kanila. So, for me, kasi sinasabi ko sa mga pasyente ko, you need to eat green leafy vegetables at saka yung mga organic and natural. Kasi kung binabawal po natin yung mga natural at saka mga organic na fruits at saka vegetables, saan ngayon kukuha yung katawan natin ng nutrients na kinakailangan ng thyroid gland natin to function? So, for me, mas important na pinapakain natin kaysa hindi natin pakakainin si thyroid gland. So, goitrogens do block iodine uptake in the body, but raw vegetables and continuing to eat sea vegetables allow for the thyroid to have all the iodine it needs to thrive. So, not necessarily iodine lang po ang kailangan ng thyroid gland natin. Kasi yun nga, Marami po. Kaya, ang very reason po na nag-create si iodized salt for the purpose of thyroid concern. Kasi yun nga, to feed up the thyroid gland para hindi magiging problema. But as of these days, marami pa rin problema sa thyroid gland kasi yun nga, hindi nga sagot si iodized salt. Kasi when we say iodized, commonly kasi with regards to iodized salt, synthetic po ang inilalagay na iodine. That's why it don't solve the problem. We need a natural and organic minerals po to be processed by our body. So, yun na yun yung magiging concern natin. So, with regards to our supplementation, we are all natural. So, kaya magiging advantage po kay thyroid gland. So, even if that is hypo or that is a hyperthyroidism. So, ang main concern ko po talaga is common with our patient kasi sinasabihan talaga na i-remove talaga yung thyroid gland. So, yun nga, gina-convince ko yung pasyente ko as much as possible, we treat our thyroid gland with natural approach. Kasi yun nga, pag tatanggalin po si thyroid gland, lifetime na po tayo nang iinom ng levothyroxine at saka medication to maintain the calcium level in our blood. Of which, our patient under a lot of our MCC star achievers. Nowadays, mayroon po. Marami po tayong star achievers na mayroong thyroid problem before. But that is corrected with our supplementation. So, kaya po siya i-manage ng supplementation natin kasi yun nga, we're giving nutrients. So, yun din po yung pinakakailangan ng thyroid gland. So, may mga buntis din po ako na pasyente kasi yun nga, very, very dangerous po pag buntis po ang pasyente na may thyroid concern, lalong-lalo na with hyperthyroidism. Kasi magsobrang may tendency po na magka-stillbirth o pwede po mamamatay yung baby sa loob kasi yun nga, with the heart rate of the mother, so mag-decrease yung oxygenation at saka yung hampered yung blood supply doon sa baby. Kasi yun nga, ang bilis talaga ng tibok ng heart rate ng mother, kaya more likely pwedeng mamamatay yung baby. So, yan na. So, when we say thyroid concern talaga, marami talagang problema na mailabas ang katawan. Pero, based on our experience, me and Doc Chani have witnessed na marami tayong thyroid problem na pwedeng matulungan with regards to our supplementation. So, all in all, thank you very much for watching this video. And I'm very thankful to our Lord God, the Almighty One, who is helping us discovering this natural remedy in our everyday life concern, especially to our health. So, thank you very much, everyone.